Good evening, everyone, and welcome to the another episode of Voices of Inspiration. So, I'm Sushil Grover, leadership coach, and that filmy professor, your host. And today I am going to have one guest who is Dr. Emmanuel Bhaskar. So, let me introduce him. He is a physician. He has 23 years of clinical practice. He has numerous scientific publications to his credit, and he is author of a very famous book that is the COVID Stories from India, that is in my hand. COVID Stories from India, Six Narrow Exits. So, welcome, Dr. Bhaskar, to our Voices of Inspiration podcast.
Thank you, sir. Thank you for having me in the show.
Right. So, tell us something about that. This COVID was that was a period that each one of us remembers it differently. Some of us lost some of their loved ones, and some of them couldn't do anything. There are so many things. Everybody has perception in his mind regarding this COVID. So you have written a book on COVID. So what was your objective in writing a book on COVID?
So, thank you, sir, for this question. So basically, I was handling COVID patients a lot, right, from March 2020. And as you know, all we saw around was sadness, death, loss of job, difficulty, facing difficult times. But even those difficult times, personally, I was taking care of patients at home. I was giving home care for people. I was seeing in the community. I was working in the field, hospital as well as in the field. But I saw a few inspirational things. Like all the six stories are actually based on inspirational comebacks of ordinary people. So none of the six stories are actually tragedies. Mostly in COVID, first thing which will come to our mind is tragedy. But I felt that there was a strong lesson given by the society on how to face, get back on difficulties. All the six stories, one common factor you will see is that the protagonists would have suffered to a brink of extinction and they would have bounced back. So that's the basic idea. And moreover, I had interest in writing fiction from my childhood. So this was another opportunity. And it took it very long period because my work schedule is tight. I just write 250 words a day. And I wrote it for 2 years. So it was a very slow process, but then I'm happy that it came out well.
So this is a fictional book, but at the same time, this fictional book, how much you would credit that this is through true incidents inspired, and what is this all about? Can you please
Sir,
elaborate?
all the six are true incidents, sir. Maybe I would have fictionated a little bit for the flavor, but all the six are true incidents. Whatever I saw, or my very close colleagues saw. So I just took it from them. Names I have changed, scenarios I have changed, but the bottom message is the same.
Acha, Dr. Bhaskar, what do you think is the single most misconception which people have about COVID?
Regarding the disease you are asking, sir.
Yes, people have different opinion, but
Yeah.
what is the most common misconception it has? So, in your opinion, what is the single most important misconception you feel that people have about COVID?
Sir, as for the disease, when the disease initially came, we had a lot of misconceptions. Sir. We were worried that when you touch something, the virus will spread. So we were washing the vegetables, and even the newspapers have been they have been decontaminated. So the transmission is only airborne. So that we came to know only after 3 months. So it was a new pandemic. Everybody did mistakes, including the United States Center for Disease Control. Almost every government did mistakes in that. So now we are clear. It's only airborne. So now COVID is almost gone, but once in a while we get COVID positive patients. But good that we have passed that phase, and good that it's not bounced back. Virus has not bounced back. We have to thank the virus for that. So we were worried that it will persist for years together, like a flu. That has not happened, fortunately.
Yes, fortunately, that is the good point. And at the same time, you have this written six stories, and I'm sure that each story is very close to your heart. But sometimes
Yes.
what happens is that one story touches you more than that of others. So,
Yeah, for me, the sixth story is the most touching. The hill's heartbeat is the most touching. But that's about a situation which happened in a tribal population in southern Tamil Nadu. It was between Madurai and Kerala, close to the Western Ghat, and that's the Venmalai is the place where that story is fit. And I kept the best story as the last story in the book. So that's the closest for me.
Right, right. No, that is okay. Yes, all the six stories definitely have something or the other. But if you have to derive one single lesson out of the book, so which lesson do you think that a reader must take while reading these your book?
So if you look from fighting back from difficulty, I think two things. The first story and the fourth story, the place where that mask manufacturing shut down restart is he was literally in a brink of death. He came back, and the first story, the abandoned cook, both real inspiration. The real world people actually inspired me. Both those people inspired me. They were my patients, but they inspired me a lot in the way they fought back and came up in their life.
So in the meantime, when you were going through those all those instances, so Dr. Bhaskar, your life has somewhat transformed or changed, or what you used to think before the COVID and after any changes in your thinking process has taken place.
Yes, dramatically it has changed because I realized that the healthcare should go to home. COVID only taught me that I should move away from the hospital, go home and see patients. Even now, I have started a lot of home care programs in Chennai. So COVID was the inspiration. That was the time where we went and treated patients at home. We gave them oxygen at home. We kept nurses at home. In fact, in certain areas, we kept oxygen support devices at home. So we treated patients at home, especially in the Delta wave 2021. Oxygen was not available in the hospital. There was no place in the hospital. So we had no other option but to use the home of the patient as the hospital. So that was a game changing, and now I think for that is good. Now a lot of home care has come out, at least in our region of the country, it has come out. It was definitely a huge lesson. It pushed me out of the hospital into the society. It forced me, I should say.
Right, right. Interesting. And this one thing more which comes to my mind, and definitely it is coming to in the minds of readers also, that nowadays that anxiety, stress, depression, and so many health issues and mental issues are going on nowadays. So, what do you think this book will be? Who will be the right audience for you? That this is the audience I want them to surely read. Definitely that you want that all must read this, but particularly if you want that this segment must read this book, so that segment, can you please
Yes,
elaborate?
sir. Sir, actually, it will be for more for young people, sir, because here is all inspirational stories. Difficult times have come out, and as you know, current the job losses, AI coming in, the future is going to be difficult for the younger generation. So that part we can say, but we should not be worried about it. I think the youngsters should make up their mind in such a way they will fight the system and keep their mind strong. So in that case, I would prefer the target people to be more young people, college going people who have just finished the graduation, and even if they are in the school, the stress of competitive exam. So all those things they have to face. And this book, I think, though the stories around COVID, it teaches you a lot of how you have to keep your mind calm, difficulty, think, fight back on the system, come back from a difficult situation. I think it will more cater to the younger people. And
Right, right. So now your this book is going to be this displayed at the Chinar Book Festival and at the same time at Jammu Book Fair. So for 14 days, definitely there will be more than 80,000 and maybe a lakh of people, those who will be coming to these book fairs. So how you're feeling about it?
I'm extremely happy. I never thought that I'll get an opportunity. I should thank you for that in the first place. Well, I never imagined that the first place where my book will be launched will be Srinagar and Jammu. I have even never dreamt about it because I have never thought it will happen. I was thinking about Delhi Book Fair or Chennai Book Fair, but that was really a big thing, and I'm very, very excited to have my book in the most precious part of the country, I should say. So I'm very, very happy for having the book there.
Great, great. And Dr. Bhaskar, I wish that this your book, as you just said, that for the young generation, it should reach to those people, because now this because I also believe that when you are suffering from going through the hardships, the tough period, So then it teaches you a lesson more than the good things are going on. So when bad things come to our life, then definitely we can learn from them. That is the true part. But tell us something about, yes, what are your future plans now?
Sir, as far as fiction is concerned, I want to write illness-related fiction, sir. Actually, I am planning to write one. I just had a thought of what happened in the 3 days during the recent Indo-Pakistan issue. 3 days power cut was there in Jammu and Srinagar. So 3 days was one concept which I thought about. Because many of my doctor friends communicated me how they ran hospitals during the exchange of shellings in those 3 days. So that was one thing which in my mind. So that is in the process. I've titled as 3 days. So 3 days, how the healthcare system worked there, how people tided over the problem. Basically, my future writing on fiction will be on social aspects of health illness. We never look into it. We just take a patient as a illness suffering, but we forget about their family circles, their parents, their kids, how they arrange for finances, how they face the job losses. So social aspects of medical illness is what that genre, I think not many people are writing, sir. Actually, globally, not many people are writing. So that area I want to write, the social aspect of medical illness and what illness does to an individual and how you have to come back from that illness. So the social aspects of medical illness is what I'm looking
Right, right. So, Dr. Bhaskar, I have this one curiosity to ask you that you have a very busy schedule, and then you have written a book also, and you are planning to write more books also. Then, how do you manage your time and writing, and how do you manage your work, family, and time to even people say that we don't have time to read, and you are writing the books. So, what is the secret behind it?
Sir, I'm a slow writer, I should say, sir. I just write, as you told, 250 words I write daily. So 50,000 words is that book. It took more than 2 years for me to write. So morning after the breakfast, or I just write after just 250 words I write. Once 8,000 words are reached, I edit it. That takes another 10 days. So I'm a slow writer, but writing those 250 words daily gives me a lot of happiness, and I feel enriched by writing. So that's how I write. It's very slow writer, but I think if you have a will, you have that time. 30 minutes a day, I think you can spend. That's what I feel. Ideas are more important.
That
Interest will automatically come.
That's great. That 30 minutes a day, not that once you throughout the day you write and another week you just drop. Just consistently you write for.
Consistent.
So that's great. So any last minute message you would like to give to our audience?
I just want them to have a look at the book, sir. Give a chance and go through it, and let they not be worried that they will see tragedies. It's all inspirational stories. It will definitely help their life. That's the purpose of myself writing that book, to reach readers. That's my objective.
Right, right. Thank you, Dr. Bhaskar, for coming to our podcast in the
Thank
Voices
you,
of
sir.
Inspiration. And I wish that this book reaches to hundreds and thousands of people, and you inspire a lot of people, and keep on writing and keep on enriching this social fabric of our country.
Sure.
So,
Thank you,
thank
sir.
you so much for coming here.
Thank you, sir. Thank you, sir. Thank you. Thank you.